My name is Beatrice Omari. I'm a consultant physician and diabetologist based at ScanLab Clinic in Nakuru. Today we will be talking about diabetes. Diabetes is a chronic medical condition in which patients have a persistently elevated blood sugar level. We have two types of diabetes. One that we call type 1, which is more common in children and young adults. These patients usually do not produce insulin, and the treatment that is required is we have to replace insulin in their bodies. We also have type 2 diabetes, which is more common in young adults all the way up to the elderly population. In this particular group of patients, insulin is produced, but it is just not enough to take care of the body functions. So the patient can be given medication, and eventually some of them do require insulin to manage their blood sugar levels. The symptoms that are associated with high blood sugar are quite diverse, but most commonly we see patients reporting frequent urination, excessive thirst, blurring of vision, and even weight loss. And we encourage patients with these symptoms to go and have a random blood sugar done. However, even asymptomatic patients, as long as we are above the age of 35, we should routinely go for a screen of blood sugar. And that can be done in majority of the health facilities in the country. The tests that are available for patients who have diabetes are many, but it is important that they are done frequently so that we monitor for possible complications. So patients with diabetes will routinely do kidney function tests, liver function tests, cholesterol tests, a test that looks at their average blood sugar over 3 months, which we call HbA1c, heart tests, and even tests to look at their eyes and to look at their nerves in case they lose the protective sensation over their feet. The complications that we see in diabetes can be divided into two groups. We see chronic complications and we see acute complications. The acute complications are more to do with high blood sugar, like hyperglycemia causing patients to go into coma, low blood sugar also causing patients to go into coma, and these require urgent medical attention. Chronic complications tend to develop over a period of time. So this include blindness or changes in vision, nerve-related complications that can cause numbness and tingling in the hands and in the legs. We have seen patients who have developed stroke, heart disease, and even kidney failure. So we encourage our patients to avoid developing chronic complications. They need to ensure that their blood glucose levels are well controlled and maintained so that we minimize the risk of developing complications associated with diabetes. Welcome to ScanLab Clinic, where quality health is our